We are so excited because we're finally bringing to you our podcast, The Double Dose.
We are such a double dose as well.
We so are. And it's been a long time coming, and this podcast is going to address all sorts of topics. Nothing will be off limits. And we can't wait. I'm Dr. Raj. I'm a GP with a special interest in skin health and women's health. I'm a TV doctor and a mummy to two little ones, a 6-year-old and a 2-year-old.
That was so slick. That's a tough act to follow. So I'm Emily. I'm also a doctor. My specialist area is mental health. I'm also a children's author. I am a mum as well. I've got 3 children, 12, 9 and 1. And that's me in a nutshell. Oh, and we're friends.
And we are friends.
This is like the main important part.
It is. So I think this whole podcast came from the fact that you and I, we have all these late night chats, don't we? Voice noting each other, talking about all our issues, problems.
Embarrassing problems.
Embarrassing issues. Literally, we have no shame. We have no shame, the pair of us. And so we thought, why not bring this shameless podcast?
Share it with everyone.
Let's just share it. Let's share the shame or shamelessness.
Shamelessness.
Let's share the shameless. Let's just share. So we're going to overshare. We're going to have fun. We're going to have humour and hopefully a whole lot of conversation.
And nothing's off limits. Nothing's embarrassing, weird, gross. We've heard it before.
I think as doctors and mummies, nothing's going to embarrass us. So we're really excited.
Let's do it.
Let's do it. Okay, so today's episode is Freeze, Fill or Filter, and we're going to be talking about all things to do with the aesthetics industry, so Botox, fillers, body image. I think it's really important to talk about this because it is a bit of a taboo topic. I don't think it's talked about enough, and it's an industry that's booming. So why not take a deep dive and
Let's do it.
Let's do it.
And this is a great topic because Dr. Raj, doctor extraordinaire, you are an aesthetics doctor as well as a GP.
I am. So I have a clinic which does private GP health services and I also offer aesthetic treatments. And actually what's really interesting is how that came about. So when I was working as a junior in A&E, at that time, aesthetic treatments were pretty new. Like we didn't have as much of an interest or boom in the public as we do now. What we would see are the complications in A&E. So I don't know if you ever came across this.
Really?
But yeah, as a junior, you'd see people coming in with like vascular occlusion or like infections from like filler and stuff. And there weren't really any antidotes. So we were kind of just, as doctors...
Did you not dissolve filler then?
You didn't have filler dissolvent in A&E, so we had to work out what to do or send them off to specialist services or plastic surgeons or refer on via the NHS, which was really interesting to me. And it made me take a bit more of a deep dive into why that was happening. At the time, I was toying between the idea of doing general surgery or GP. So when I got into GP land, I realised that this was an area I wanted to explore further. And that's kind of how I fell into having my own clinic and making sure that the standards when it comes to being ethical and, ensuring the safety of treatments is paramount, where that all came from. So this is a topic I'm really passionate about.
Yeah.
And I think it's important to talk about it when you have a platform because oftentimes it's not discussed openly. It's a bit of a secret thing.
I think more so now. I feel like people are more open about having things like Botox or fillers. Like I think a few years ago, it would have been seen as like quite unusual or maybe even shameful. I do think people are a bit more honest about it now. Do you think or not?
Yeah, no, I think they are more honest about it. And I think it's not that they're not more honest about it. I think there just is a bit of a shame or a taboo attached to it. So if somebody comes out and says, well, I have Botox, it's almost like we still have that, well, do you? Why do you do that? And I think it's that element of it is what's maybe preventing us from talking even more openly about it. And if we're not being more aware and open about it, you have shame attached to it, and then you have the secrecy, and then you have people having treatments maybe from the wrong, people or those who don't have enough experience or the right qualifications. And I think for anything to be, done correctly or for us to change a narrative, we need to raise awareness and talk about it openly. So I'm glad we're having this conversation today.
Do you think many people realise that Botox is a prescription medication and therefore has to be prescribed for you as well? That's the thing. It has to be an individual prescription for that particular person. And there are people out there offering Botox who are not prescribers. And obviously they usually work with a prescriber, but there's people going, backdoor ways to get Botox and to administer it to people without going through the proper procedure. I don't know if a lot of people realise that.
I think since the guidance changed around you having to have a prescriber to give Botox, to treat using Botox, since that guidance changed and since that law kind of came into place about having to have a prescriber or a doctor on site to help you prescribe. I think since that came about, there has been more awareness around it. But I do think that, yeah, you're right. People are getting around it and are cutting corners, and it's still an issue. And I think for me, and probably you feel the same way as a doctor, the issue is it's a prescribed medication. There are side effects.
It's prescribed medication for a reason.
Yeah.
Because you can get complications if it's not done properly.
And Botox has no antidote. So you want to make sure when you're getting it done, in a safe pair of hands, and that complications can be managed if necessary. Hopefully that's not going to occur. But I think it's that whole narrative around, is it just a bit of, the whole spectrum of where you're just having a bit of a treatment, but actually it's not a bit of a treatment. It's actually a prescribed, medicated.
Exactly. I hear people going to Botox parties, Raj, and I'm literally like, I like recoil at the thought, because I'm thinking in my head, well, if you're at a Botox party, there's not a prescriber there seeing each individual person. You've just got someone. I mean, unless it's unless it's a nurse prescriber,
but ethically,
a doctor. But I just think, oh God.
But ethically, I wouldn't as a doctor be at a Botox party, because that procedure or that treatment needs to be done in a clinical setting where
without
alcohol, everything's around me, informed consent, going through the procedure calmly, making sure everything's done properly. I don't think a party with champagne or whatever it was going on, noise, music, is the 100%. Correct environment. With lots of people peering over. That to me is not the way to carry out a Botox treatment. And I would never advocate for that to be the case. I think where you have beauty parties or makeup parties, it's gone from getting your nails and pedis and manicures or your hair done.
That's a different level, isn't it?
Yeah, but don't you think that's where the lines are getting blurred now? Yes. Now those parties are turning into, let's have some filler, let's all get together and have some Botox. I think we need to be clear about what those complications can look like. I think until you don't know it until you know it. So until you're in a situation, you're not going to know how bad that could be and how detrimental it could be to your health. And I always say that if you come into my clinic and you're coming in for a private GP appointment, you probably have a health issue and you're coming in, or you will have a health issue most times. But if you're coming in for an aesthetic treatment, you're normally quite fit and well generally.
Yeah.
So I want to continue that safety for that patient. I don't want to make somebody unwell through an aesthetic treatment, because it isn't an obligation. It's a choice to have something done to make yourself look better or feel better. And it's not necessarily for your health, right? You could argue well-being, especially psychological well-being, and because it makes you feel better. But I think if somebody healthy is coming into clinic, I want to make sure I'm doing everything I can to preserve them being healthy and doing things safely.
Thing is, Raj, any doctor will tell you this. You can have a complication when you do a procedure. Even if you've, let's say you've been a surgeon for 20 years or 30 years, you can have a complication. That's just the nature of it. So you could go and see the best practitioner, a prescriber, and you might have a complication, but you want to reduce the chance of that happening as much as possible and go to the right people. I mean, filler for me, in a way, actually, is more frightening than Botox, because it's not a prescribed medication.
Yeah.
So you can much more easily buy it over the internet, go around and inject people with filler without having the proper training or being medical at all. It sounds silly, like we've got experience of dealing with sharps, how you do make it sterile, infection control and all of that. Filler's in a way more terrifying, and you can really get disfigurement or complications with filler if it's not done properly.
I think your point around complications is really important. I say this to my patients all the time. So I say to them, look, it's not that you go to a doctor, and this is really an important point, that you go to a doctor or a qualified surgeon or whoever you're going to, and that you're not going to get a complication. Of course, the more you treat as well, the more numbers you treat, the more your likelihood of in complications rate goes up, and that's normal in surgery, in hospital, in any specialty you do.
We're humans.
We're humans, and that happens. And sometimes it's not even in your control; it's something else that's happening. So, for example, you might be treating somebody for an infection or potential infection after treatment because you're injecting and you're making, obviously a puncture into the skin. So there's lots of different complications that can arise. I think that what you said is completely true. It's about how qualified you are and comfortable and experienced to manage those expectations. So in my time as a doctor, an aesthetic doctor, I have had complications, absolutely. But I manage my patients with such, detailed
well, you've got the knowledge to deal with the complications when they arise as well, which is the other advantage.
Making sure I'm available to them, make sure they have access to me, especially if they're having certain treatments like a dermal filler, because there is risk of things like VOs, vascular occlusions or infections. And I think you're right. People just don't realise how dangerous it can be to have that tool in the wrong hands, because you have nerves running through your face, vessels, and filler is, yes, you can reverse it, but you need to know how to reverse it. And you've got to know
what the signs are and get on it quickly. Yeah. That's like
a whole...
I don't know why I'm frightened of filler. I just am. I just am frightened of it.
Have you ever had any filler?
No.
I love that you just told me that.
I'm too scared.
Should we talk about what we have had?
We can talk about that.
Yeah, I just think
I think it's important because when, you see people on social media and everything, I think the easy thing is to think that they haven't had anything done, or, it's just, they just look like that naturally. I think a lot of people, it's lighting, it's maybe a few treatments, it's makeup.
Yeah, I think the thing to say as well is that most people think aesthetic treatments. As soon as you say I do aesthetic treatments or I'm an aesthetic doctor or practitioner, they think, oh God, for Botox and filler, you're getting a needle out. Actually, that's like such a small percentage of the work that I do in clinics. I focus more on skin health and skin than filler. So, it could be, energy-based devices. It could be lasers. It could be peels, facials.
You've given me a peel.
Yeah. Do you remember that lovely time I gave you a peel?
Oh, I loved it.
Reason your skin's glowing so much.
And you gave me a little face massage afterwards. She was there with her soothing hands, and I was there like, oh.
Yeah, I think you fell asleep, didn't you?
Probably.
And chemical peels are supposed to be painful, but
I fell asleep having an MRI scan. Can we just say that?
What?
Seriously, I was having an MRI on my neck. Right?
With all the
yeah, because do you know why? Tell me now, when do you ever get 45 minutes enforced laying still in the dark with music just gently playing in your ears and nobody needs or wants you?
You do realise that's my worst nightmare. In those 45 minutes, I'd be thinking I could be doing so much right now.
Oh, I was loving it.
I normally get told in my earpiece, can you stop moving? So I'm like, I've got an email to send.
So do you know when I moved? It's because I twitched. I was falling asleep.
Oh, you
I was
just falling down the stairs thing.
Oh. And then I said to them, sorry that I twitched halfway through. They were like, hardly anyone falls asleep in an MRI. I was gone.
Only you would. You'd love
I'm tired all the time.
I love it.
Actually, let's not talk about that.
So what have you had, Ems?
Well, you've given me a peel.
Yeah.
You've given me Botox, actually. Yeah. Very well. Basically, I like going to see you because then we can just have a chat and a coffee.
I know, right?
I actually had Botox originally because I get a lot of headaches and migraines, more specifically. And I think that's the other thing with Botox people don't realise is it can also be medical, medical treatment for various things. I actually find it massively helps for that. However, I will say the anti-wrinkle side effects are also
beneficial,
not unwanted.
Yeah, of course. I think with Botox, it does work well for muscular pains. You can use it for migraines. Also, like masseter Botox, I do a lot of those treatments for like grinding.
Oh,
and
really?
That can cause also headaches as well, like tension headaches. So there definitely is an indication to help with that. So I have Botox twice a year, and mine's not for muscular pains or headaches. It's just because I want to have less wrinkles on my forehead.
No, mine is also for that. Now,
yeah.
And now that I'm older, I'm like, okay, I'll take it.
But look, I have wrinkles. Like my Botox, I can move my face, like I can. And it's important to me that I do have movement because I think as a doctor and as an individual that likes to have expression, that's important. I think sometimes when you are doing treatments or when you're having treatments, or if you know somebody's having treatments, you automatically assume, oh, that means your face is going to be frozen or you're going to have. But you can have subtle treatments that actually make you look natural. So I think
that's why you go to someone experienced.
Exactly.
This may not be a popular viewpoint, but I would only see a doctor or obviously a prescriber. I preferentially would go for a doctor.
Might not be popular, but I think it's a safe and sensible thing to do. And I'm not saying that because I'm a doctor and that I'm biased, although you might think I am. But I think it's really important that even if I were to advise a friend of mine, even if they weren't coming to me, just go to somebody that's qualified enough to deal with complications, who can make sure that they're experienced in what they're doing and that you're safe when you're having treatments done if you're going to opt for them. So obviously, if you're going to have Botox, you have to have a prescription now. That's a legal requirement. So that kind of, in some ways, does narrow down who you're going to be able to go to anyway. So I think having that legislation kind of coming in and hopefully with more sort of restrictions and safety restraints in place, things will get better. So let's see.
I think it's being talked about more. Yeah. And there's going to be licensing coming in, isn't there?
Yeah, there is.
Which is absolute music to my ears because I think, you go for a treatment like that, usually to try and improve, like you said, your well-being. If you then have a complication, it's going to do the exact opposite. And I've seen, many cases, especially recently, I think people are talking out a lot more about some serious complications that have occurred and some really sad cases where people have actually died. Not from Botox or anything, but some more invasive procedures, but still done in a clinic and quite often not done by a doctor. One particular case I'm thinking of, I don't know the exact treatment the lady was having.
So there was that very famous case where the lady had a BBL.
So was it filler? Was it filler BBL?
Filler, and that ended up with her sadly obviously in death, so she died. And there's been a second case, I think, as well that's happened more recently. So there's definitely need of clamping down, and I know that there's work being done with the government, with the British Beauty Council as well, and there's stuff happening in motion for that to happen. So let's see. I think we're definitely moving in the right direction. This is not to put anybody off, you know. And also, you know, I work with practitioners and facialists. I think there's some of them are incredibly experienced, but I think it's about having your experience in your field and doing what you know you're best at, rather than trying to give a treatment which potentially could end up with serious side effects or even death of, you know, a client. So I think it's really important to focus on that.
And just having that support of a prescriber, because there's absolutely, if you know, if somebody's working and they're working in a safe way under a prescriber and somebody that can help manage the complications, great.
As long
Unfortunately, it's not always the case.
That's it. As long as you're following the guidance and you're not trying to find a loophole, because that's just not the right thing to do. Yeah, you can't put people's lives at risk. As I said, those patients come in safe, normally quite well, and then you don't want to put them in a position where they're having facial disfigurement, you know, they're feeling worse about themselves or ill now because of the treatment they've had, or even worse, still death. There's just no need for that. I do think that it's important to touch on the topic of how, you know, having a treatment done, though, I'm not just talking injectables, I'm talking about generally aesthetic treatments or cosmetic treatments, peels, skin facials, whatever it might be, can make you feel better about yourself. Like, it can make you feel more confident. It can make you have a better psychological
100%.
well-being. And that's not talked about enough. So I think sometimes having a little pick-me-up, whatever that
I'm not against that at all. I've always felt like it's... I don't know if this is correct, but for me, it's kind of all on a spectrum of changing your appearance to some degree. Okay, so on the very bottom end of the spectrum, you've got maybe dyeing your hair, wearing makeup, you know, even using skin products, moisturizer and things. And then you've kind of got the Botox, which doesn't, I guess, change the anatomy of your face, but just more how your face moves. Then you've got kind of fillers, which do change the shape and way your face looks. And then you've got at the other end of the spectrum, cosmetic surgery. Yeah. And for me, every one of us is on that spectrum of amending our appearance somewhere. Okay, even if, you know, it's getting your hair cut or whatever, but it's about finding what sits right for you. And some people want to change their appearance more, and that is fine. Some people don't want to change their appearance at all.
La Roche-Posay is a brand that I am proud to have worked with for a few years now. It is truly a brand that I recommend in clinic all the time and use myself too. I also trust to use it on my kids. The brand is arguably best known for its incredible Anthelios sun care range. The best SPF is the SPF that you want to wear every day and that you can trust to protect your skin. It is recommended by dermatologists worldwide, and for anyone that is concerned with signs of aging, a solid SPF is arguably the most important step. My favourite has always been the Anthelios UV Immune 400 SPF 50+, formulated with Mexril 400, the most efficient filter against the most penetrative UV rays. It is very high protection, broad spectrum, protects against UVA rays too, and importantly for me is non-greasy, does not leave a white cast, and it's suitable for sensitive skin. It is such a lightweight fluid. I challenge you to find someone that does not get on with it. Have you tried it, Em? Well, you should.
Thanks. Truth or myth?
Truth or myth? That's the gift. That's the gift. Truth or myth?
Bring out the moves.
Okay, let's go. We're going to say a truth or a myth, and then we're going to work.
I'm going to ask. We can take it in turns.
Yeah, okay, go on. Who's doing the first one?
Me.
Go on then.
Ready? Dr. Raj, we should know the answer to this because we've just discussed it, okay? So for anyone listening, if you don't know, you haven't been listening hard enough.
Yes.
Botox and fillers are completely safe if you go to anyone who offers them. Truth or myth?
I think that definitely, Emily, is a myth.
I think we established it.
We kind of went through that, yeah. So although surveys have shown only about 32% of aesthetic practitioners are actually doctors who carry out these treatments.
See, I would have thought it would have been more than that. I thought it would have been higher. Obviously, dentists, I would assume, make up a fair proportion. Quite a lot of
maybe,
dentists.
yeah, maybe that doesn't include dentists, though, just doctors.
No, I would imagine, yeah.
But we know we need the training. We need to know the anatomy knowledge. You know, these things matter. There's obviously safety profiles to think about. There's a whole mental health, psychological screening to think about. So there's a lot that goes behind actually doing the treatment, which I think, and the complications risk, obviously. And I think that's what that alludes to, that, you know, it's not completely safe just to go to anyone. So I don't think your hairdresser should be injecting you unless they're also dual certified as a dentist, doctor, or a prescriber nurse. So yeah.
Do you know a dual certified hairdresser doctor? I always wanted to be a hairdresser. Do you know that?
You could be the first one.
I could have done that. I could be the first one.
You could do it.
No, very important, because I think as well, people can be trained, but there's a huge variety in training courses in terms of the quality of that as well. So you may get someone who's got a certificate, but I would strongly recommend look at where they've trained, look at the course as well if you're not sure about whether it is.
Do you know when I decided to go into aesthetic treatment? So I was obviously qualified doctor. I'd also had surgical training under my belt. And so I went then to do my aesthetics course. This is years back now. And I kid you not, I did a 2-day course. And I was encouraged. I'm a doctor, by the way. So I've got anatomy training, complications training. I was encouraged at the end of that 2-day course to start up my own business. And they said to me, start injecting straight away. I remember,
I've done the training. I've just never used it, but they said exactly the same thing.
Emily, I remember slowly backing out that room thinking, right, definitely not doing that. I had no confidence. I then went away and did my level 7, so the diploma in aesthetics training, because I felt, I definitely don't know enough. And I'm a trained doctor. Like I've, been in theatre, I know my anatomy, I've done all those different things, but I did not feel comfortable just getting a needle out by myself in a room somewhere.
I didn't either.
And isn't that weird?
But also all the bits that would be second nature to us, like I said earlier, dealing with sharps, drawing up the drugs, mixing them, how to do that safely, things like avoiding needle stick injuries, all of that stuff that we just do without even thinking because you get used to doing it at work. That's all kind of done. But just the doing the procedure itself, assessing the face, looking at that person's anatomy, what's the best treatment for them, where should you do it? That really I found was a lot. So I've been on multiple training courses. Some are much better than others, I have to say.
Oh yeah, there's definitely a variety. And I also think it's about all those things you've mentioned, but also because obviously everyone has complications as we mentioned, but I think it's about being comfortable enough to not be worrying about that every time you inject. Like now I'm at the point in my life where I'm very comfortable. Thousands of procedures. Like I don't worry. And I actually am very happy to say to somebody, don't you worry, you're in really good hands. And
I've got you.
I've got you. And I think I didn't feel like that after a 2-day course. And what was worrying to me, and maybe it's because we're medics and we are held accountable for stuff, and we kind of have this whole GMC and we've got accountability and we've been, trained that way to think like that. Maybe that's the reason why we were questioning, oh God, I'm not ready for this. But if you don't have any of those things, like we said before, you don't know what you don't know, you're going to just go into it thinking it's fine. I've been told by this training provider to do it. Yeah. And I think for me, it was after my level 7 diploma training and actually starting my own clinic and actually, had loads of experience from doing the treatments before that I felt comfortable. And I was like, actually, I'm okay. But it took years of training, let me say. A bit like how it would to get into a speciality. So I see aesthetic medicine as a speciality now. And it's actually part of the Royal Society of Medicine. So it is actually being recognised as a speciality of its own, thank God. So actually, that's how I see it.
1 in 5 18 to 25-year-olds have had fillers or Botox. 1 in 5.
1 in 5, ooh.
And that's young 18 to 25. What are we going with?
I'm going to go with... I'm going to break the narrative.
Just find the card.
Truth.
Dr. Raj is correct.
I am correct. Well, I think, you know what? Weirdly enough, that doesn't surprise me.
I was surprised by that.
You?
Yes.
1 in 5, that's like, what, 20%? I think it's like... I think because I see it, there's so many young people who seek these treatments.
Even Botox before the age of 25?
Yeah. And,
really?
And honestly, the answer is no. Like I barely ever give Botox to somebody who's under the age of 25, for maybe relief from muscular pain or headaches, whatever, they might get it. But I think
this is actually talking about aesthetic treatments though, isn't it? I think we can safely say the 1 in 5 is not talking about people having it for migraine. I didn't have any Botox till I was 30.
Yeah, same.
That felt an okay age for me. Pre-25 is very young.
When I was growing up, there wasn't, celebrities weren't having, it wasn't out there. There wasn't like a Love Island or, celebrities having Botox or looking really airbrushed. There was expression. People had lines. It was normal. When you look through magazines and stuff, you could still see that. I think the culture of like being completely perfect per se has been in the last decade. And I think what you're seeing really now is that nobody wants a line. Everyone wants overfilled lips or, really smooth foreheads. And even when you're young, that whole youthful, glowy movement you have, it's not seen as desirable, which to me is like shocking.
Like maybe more for women. And maybe I'm wrong.
Oh, yeah. Definitely.
People might disagree. I feel like with men, there's this whole thing about actually they can look better as they get older. The whole kind of George Clooney thing, right?
Oh,
that going grey is kind of... We were having this talk the other day, okay?
Yeah.
Not many men mind going grey. I think a lot of women do. I think a lot of women do like aging as a woman, I think is complicated.
I think it's that whole thing about the patriarchy and how, men can be a certain way and get away with it. And then women have to always almost be that, slightly more submissive and giving in to what is wanted by the male eye or whatever it might be. And I think male gaze rather, but I think it's more about that feeding through the generations now. And now it's not even about men and women anymore. I think it's just about always having the pressure to look a certain way, to look younger, to be desirable, to be, still catch up. Whereas with men, they don't need to look younger to be desirable. They can have 11's lines and they can have, grey hair and be the silver fox.
And that's seen as being desirable.
And it's like, look at him. I'm with my hunky silver fox, No one ever says that about women, do they? Why not?
No.
Although there's some amazing content creators
who embracing the grey.
Embrace the grey. I love that.
I haven't reached that stage in my life.
I don't have any greys yet.
Oh,
one vice, thanks, Dad. One good gene that I have. Actually, I have more than one good gene from my parents. But
just at the front on one side. Like, why is the right?
Have you got greys? Where?
No, that's because I got them covered up at the hairdresser. She just literally does this little bit here. She laughs at me.
So you don't need to brace them just if there's just one section.
Sometimes I'll get one in the middle right at the top, and it always seems to stick up.
Have you seen the one? Have you seen it where they've?
Is it Tinky Winky that has the dead straight? No, which one is it of the Teletubbies? Dipsy, it's Dipsy with the
Tinky Winky.
That's me with
Dipsy. La la.
Poe the round one.
If I could just take a photo of you right now. I'm not going to say on camera what you look like.
Okay, no, just smooth the greys back down. No, I think men do embrace it more.
Yeah, definitely.
I do think though there is more pressure on women to be youthful,
absolutely,
to look young, to stay young, to look a certain way. I do. And the rights and wrongs of that.
You see some movement. I think that whole thing about embracing the greys with the balayage and, where they've got the grey coming through, it looked quite cool, I think.
I'm just not ready for it, Raj.
Not ready for it, yeah.
You know what's really annoying as well? My lovely husband has got virtually no grey hair.
He doesn't have any greys, does he?
No.
Because we were talking about it the other day.
An odd one. Like maybe a couple in the beard. But I'm thinking, I'm going to really be having to dye my hair for years. He's not going to go grey for ages. Can't go grey before him. That's a shocker.
I think it's going to take time for that narrative to change, if I'm being honest.
I don't think it's going to change anytime soon, unfortunately.
Okay, next up we have...
things we wish someone had told us. And obviously today, talking about the aesthetics industry, I feel like for me, growing up, there was a lot of things I wish people had told me about the aesthetics industry. Mm-hmm. That, for starters, a lot of what you see isn't real. Mm-hmm. We can come on to more of that another time. But I know there's something you felt you want to talk about in this section.
I think for me, it's the being a woman of colour. And I think it's the idea that, like, what's desirable? Like, what do you see that's desirable? And it's really interesting to me that women will come in, even men actually, and they'll want a specific look. So they'll want to have a smaller, pixie, more naturally Caucasian looking nose, or they might want to alter their appearance to, be lighter, or they might want, change their skin colour, or they might want to inject Botox in a certain way so that their eyes are more lifted, for example, if they're Asian, or there's all these different things that I see, and I had to look at that unconscious bias within myself. And growing up, when you're fed a narrative and that's all you see in the media and that's all you see in magazines, that's all you see on social media, you do think as a young girl that maybe you're not as desirable and maybe that you need to change yourself. And I think I definitely, in my sort of teenage years, maybe even early university years, sat in that space, and I did definitely feel like, I wish I could change my nose, or I wish I could be a different skin tone, or my eyebrows are too bushy, or I'm too hair, all these, my hair's too dark. And I think I went on a journey of chopping my hair really short and then dyeing it all different colours, and then wanting to alter my appearance in different ways, or my makeup would be different. I'd wear I've always been quite fair, I'd say, for an Indian girl. But I would, it would be desirable for me to be, at times it was trending, to be more bronzed out. And, my foundation would be 3 shades darker or whatever. And I found it really difficult to just, I think, accept myself for my ethnic look and how I would present, because there was nobody on TV or in magazines really to look up to in that way. And I think when people say to me, you do lots of media work, a part of it is that I want other young girls who are from the same background to look at TV or look in magazines or look on content, look online and think it's okay to embrace yourself like that, to be that colour, to have that nose, to represent your ethnic background. I think if we don't find those variations, we're going to all end up as clones of each other. And that scares me. And I think as a doctor, not just a GP, but who deals with mental health, and that you do too, but also in aesthetics, I have responsibility to make sure that I preserve that, I think, to some extent. And I think when a young girl comes in and says to me, I just really don't like my nose, or it's too big, or it's too Punjabi, or it's too whatever, I often say, well, I used to think that about me, or I used to think, blah, or whatever it might be. And I share that story and I kind of say, but actually what you'll find is that those imperfections that you see, or those differences, are the things that make you you. And actually one day you're going to embrace that. And now that I'm into my late 30s.
I'd say age is a big factor in that.
Massive. I look back and I think, what was I thinking? But I think we all go through that journey, don't we?
100%. In your, it may not be about ethnicity. It might be about, whatever it's about for you.
Did you go through that?
Definitely. I think because I was a very late bloomer, I just felt like a boy a lot of the time. Like all my friends had gone through puberty. They'd all grown up. They all had boyfriends. They'd all had their first kiss and all of that. And I just was so far behind that I spent a lot of the time wishing I could grow up more, wishing I could be more like the other girls.
Yeah.
And feeling quite critical of myself because of that, I think. And I look back now and think, oh God, you don't want to go through puberty early. You don't want to enjoy being a child while you can. But I did. I spent a lot of time comparing myself against other people and feeling like I should look a certain way or behave in a certain way. And what I tell my kids now is just be you.
Yeah, I was going to say, what do you do? Yeah, what do you differently? Yeah.
You most things about yourself, you can't change. You are the way that you are, and that's lovely.
And that's your quirk, isn't it? That's you.
Like you said, we're all different. If we were all behaving and looking the same way, it would be extremely boring.
And I think you find your people, don't you? I think you find people who love those quirks about you.
Yeah.
And then you're like, oh, what was I
You
worrying
love them
about?
Yourself.
Yeah.
That's
so you've got to love them.
amazing.
I think once you start to love them, you gravitate and people gravitate towards you who can sense that confidence and that self-love. And it's okay to have that. We're always joking with each other, aren't we? I'll be like, oh, Em, you're so organised, and you'll be like, oh, Raj, you're so all over the place. But I've
never said the words to you, Raj, you're all over the place. Can we just say that for the record? That's never once come out of my mouth.
You're so polite, you'd never say that. You're probably thinking it, like, freaking out, this girl. But you're always like, I'm really sorry, are you okay? Which basically means, are you actually okay? Because you haven't replied to me. Okay, so you're actually like, where are you?
Hello.
We have a podcast to film tomorrow.
Raj. Okay, so this section we thought we can just briefly talk about, because obviously we are doctors. However, I would say doctors are probably quite notorious for not actually following their own advice or following advice that other doctors have given them. I know I am definitely guilty of that at times. So we thought it would be quite funny to do a section on the doctor's orders that we as doctors actually break.
Yeah, let's do it.
So I think when we're talking about the aesthetics industry and all the things we've talked about, one thing that I would advise people, and I'm sure you would say the same, is don't be overcritical of yourself and your own appearance. Don't chase trends, I have been guilty of doing both those things, I can tell you. Yeah. I am still critical of my appearance. I try not to be, but it does creep in, that little voice sometimes.
I think it's natural to be critical of how you look, because it does feed into so much of how you feel and vice versa. It's like a cycle, isn't it? So if you feel good, you look good. If you look to yourself, you look good, you feel good. It's that whole thing. And I think that's definitely, I will sit there till kingdom come and tell my patients, come on, you're beautiful, don't criticise yourself, and then you'll go home.
I was going to say, I bet you go home
and go, what the hell, how am I looking today? Why has nobody told me I look like this? I think at the end of the day, you
never do. But I would say you are sometimes critical of yourself.
I am, yeah, absolutely.
Despite being confident outwardly.
Yeah.
And
I will go and I'll say to you, I just don't look good. This is happening today, or my hair's not sitting well, whatever it is. But definitely that's one that I break. And don't chase trends. I mean, what trends have I chased? I'm trying to think.
I think for me, on the trends one, definitely I wouldn't chase a trend of a medical procedure of Botox or something. I'm quite careful on that. I would be much more, I would discuss it with the doctor or whatever. Just do it for me. But certainly makeup, things like that. I would look at how other people do things, and I think, oh, maybe if I just did that, I would look younger, or I would I'd feel more confident, or whatever it is. Yeah. And it's not always a bad thing, because it's nice to get inspiration from other people. But
I think there's a fine line, isn't there? You can chase a trend and you can try something out, but in doing so, you should feel confident about yourself in that. If you're doing it to run away from who you are and how you look, that goes back to the previous thing we said. Yeah. Then, when I was talking about university, how I try and change, how I looked, from an ethnic point of view, I think that's not okay. Like, I think you should always be accepting and loving of who you are. But yeah, I think I've definitely been like when I was cutting all my hair off and everything. But actually, I never even wanted to do that. I look back, I'm like, I always loved having long hair. And I was doing it because I was trying to chase a trend of being like, maybe it'll make me look more with it, or like, a bit more out there and less Indian girl with the long hair. Indian girls have the long bushy hair and bushy eyebrows.
Well, beautiful
But
hair.
but look, it's taken a full circle, and I'm back to like, this is my hair and this is how I want it to be. And also, I remember when I'd go online in the earlier days, like a few years back, and I didn't have such a thick skin, people would write saying your eyebrows are like slugs, and I remember being like getting really affected by it. But now I reply back saying, well, literally, I'll reply back, what do you want to do? I'm a hairy Indian girl. Like, I am hairy.
Have you actually written that?
Yeah.
Do you know what? I remember I had a comment
What do
once.
you want?
This stuck in my head, and I don't know why. And me and the kids actually laugh about this now. Someone once commented on a picture of me, this was years ago, saying that...
What does this say?
They said, I look like a boiled egg with a face.
What?
And then I looked at the picture of myself. I was like, oh my God, I actually do.
Humpty Dumpty sat on the wall.
I proper looked like an egg. I can't explain it. Maybe it's the shape of my head, a bit pointy at the top.
To be fair, you do look a bit like I'm joking.
An egg? I know, right?
You do not look like an egg.
And my kids found that hilarious.
If you look like an egg, I want to be that egg.
I do look a bit like an egg with a face. However, I didn't
What did you reply to that comment?
I didn't reply. It was on a news article.
Okay, seriously though, like this is serious now. When you got that comment, because I want you to share this, how did it honestly make you feel?
So originally I was upset. But I was probably only like mid-20s then.
Yeah.
And then the more I thought about it and looked at pictures of myself and thought, oh, actually, in some of these I do look a bit like an egg, I actually started to find it actually quite funny.
Oh, it's really sad that you
At the time, I was a little bit upset. I used to get comments of people a lot saying, just have a haircut. Like, your hair's just so long, it's everywhere.
But
or like...
when you said that you saw that comment and then you looked at your picture and you're like, actually, I do look a bit like an egg. Can I just say, like, that's really sad for me to hear, because can I just tell you, you look nothing like an egg, first of all. And I'm sure all the viewers...
I actually love eggs though, guys.
I know you love eggs, but I need to just get serious. I need to deep dive into this.
No,
I know you get awkward about this stuff, but I'm going to go there. You are actually beautiful. And I don't just mean how you look. You're a beautiful person. That's why we're friends, because I don't hang out with any losers. No, I'm joking. No, I'm joking. I just feel like you're just a really genuine, kind, beautiful person inside and out. But let's talk about your appearance for a moment. You are actually beautiful. There's no part of you, no, seriously, it looks like an egg. So what's upsetting me is that you've read that comment, and rather than being like, okay, it's upset me, it's not very nice, move on, I'm not an egg, you've actually gone back, looked at your photos and been like, I do look a bit like an egg. And now the next question I want to ask you is, so after confirming to yourself that you look like an egg, did you change anything to de-egg yourself?
No. Just peeled the egg. No, I didn't.
What did you do? Did you change your hair? Did you change your...
No, I didn't actually change anything. I did get a haircut after I saw a few people saying your hair is just way too long. It's a massive mop. I did get a haircut because my hair actually used to be longer. Basically, I have long hair. I don't know about you. My hair is much easier to manage when it's long, because when it's short, it's very thick and it just
You've got to
thicks
style
out.
it and stuff, haven't you?
And I have to style it and I can't be bothered. So it's actually lazy having it long. But the reason I brought up about the egg thing was that I was trying to teach the kids a bit about, like, people will say stupid stuff. Yeah. And you have to let it just bounce off you.
And have you done that now? You like off?
Yes, I'm much better now. I think I'm just older. You know what I mean? I was young. I was probably mid 20s. Yeah, probably.
And I think it's a really important point. And I tell myself that, like, my children are a bit younger, so I'm not at the stage to explain that to them yet. All the joys to come. But I do say to myself quite often when I get horrible messages that,
Do you get horrible messages?
Yeah.
Do you?
Yeah, you always get messages of, like, you think you look like this, or you or your eyebrows are this, or your skin is this, or, I even get comments like, oh, like when I'm wearing makeup, because obviously the whole thing about wearing makeup and looking a certain way and being a doctor, it's just not accepted, is it? Why you can't have brains and wear makeup, apparently. That's not allowed. So in my early TikToks, I would get comments like, oh, but you should wear so much makeup. It's like, what's my makeup? And I actually made a response video saying there is no research to state that my makeup has any correlation with the number of brain cells I have or what information I'm sprouting to you, whether my information is evidence-based, whether I can treat somebody, whether I'm a good doctor or a bad doctor. My mascara, my lipstick, my blusher, my skin tint has no correlation with that. And I promise you that I'm actually really good at what I do. And just stop looking at what I'm wearing. I'm not going to stop wearing makeup because I really enjoy it. And I like doing those two things at once. And I want to be representative of the future generations to come who also can feel like they can do both things at once, because we absolutely can. Why can't I not? Why can we not enjoy what we wear, enjoy putting makeup on and taking care of our appearance and having a brain cell and having a career which, you know, is public facing, but also educational and also a doctor or whatever it is that we want to do. But the point is, we do get those comments, and I use those now to tell myself that the person who's writing that is just really probably unhappy with themselves and they're going through something.
That's how I think.
And I actually see it in an empathetic way that, you know, and so my responses are quite humorous now to those.
Do you respond back? Because
not to all of them, but some I do.
I don't. I feel actually extremely lucky. I get very rarely negative comments. I feel like the community online, for me, is very kind and very nice. It does happen occasionally. I generally don't go back to the comments. I tend to leave them and ignore them. For me, I feel like that then puts it to bed. I don't focus on it. I just would focus on the positives. But I do see other people go back.
I mean, you know, when you get comments, I mean, like you said, the bulk of them are lovely and they're all about, you know, doing well or, you know, enjoyed this content, whatever it is, it's really helpful. And I have some great messages from people saying that, you know, you helped me, you saved my life.
Oh, your content's
you know,
I love it. I learned stuff from your content as well.
I do try.
Didn't know that.
I think the odd one here and there, you know, I don't respond to them all. I think it's just, there's no point. Because like you said, you just move on and you don't can. And as you get a thicker skin, it doesn't bother you. But I think when there's one that particularly goes for me that's about, like, you know, my bushy eyebrows, for example, I did respond because I didn't want somebody else to read that who's maybe going through something similar, thinking, God, my eyebrows are bushy too and I'm hairy. And they're seeing no response from me. So I put a nice, friendly, but funny comment back normally, being like, well, that's just quite accepting of who I am, being like, that's just my eyebrows. Sorry that they're upsetting you so much, you know, but something I could do about them. Maybe just scroll or don't follow me. I always write something like that.
I think it's kind of good that you go back occasionally.
Yeah, well, you gotta address a keyboard warrior every so often, right? Okay, listener questions.
We did have a listener question actually, and to be honest, I would be interested to know your point of view on this as well. One of the questions was about whether you can get Botox from a beauty therapist. I think we've kind of touched on that.
Yeah, we have.
So the answer to that is obviously yes, you can, but as long as they're properly trained and they're working alongside a prescriber who can see and prescribe the Botox for you. So we've kind of covered that. The other questions we had were talking about some of the kind of viral trends online.
Yeah.
So some of the ones that sprang to mind for me were things like baby Botox.
I think if the question is it okay to have baby Botox, for example? Well, yeah, it's okay. It's just that, you know, it might not. I don't really carry out baby Botox, but basically means that you're kind of diluting the dosing and you're kind of like sprinkling a bit of Botox, you know, to give some effect, but not quite an effect, but whatever it might be.
That was my understanding as well. And I just thought, actually, I think people perceive that if you just have less, it will be more natural. I don't think that's always the case, is it?
I think with Botox, it's about the individual person. So anybody comes in front of me, we map out what they need, you know, and it's very much dictated by the patient or the client, because some people don't mind their, you know, forehead lines, for example. They just want to get rid of the 11. Some people want the other way around. So it's very much, I'm not going to tell you what you need to do with your face. You know, if you want an opinion from me and you want to know what I think, I'll give that. But I always let the patient lead with what they feel they want. And so if they say, I want a sprinkling of Botox, my question is, what do you want to achieve from that? Because most times when you get down to it, they do want the treatment, but they've just heard about baby Botox online, or they think that means you're going to get less, it's safer. So once you debunk that and you get into the knowledge of it, they're actually happy to have a normal Botox treatment. And actually it's more value for money because you're getting the treatment you need, you're getting the results you need.
Treatment will last
longer, and you're getting what you want. And if they want some movement, they're thinking that baby Botox is going to give them more movement. You just need to rearrange the injections and the site positioning and have a good conversation. So for me, baby Botox is not really a thing. Okay, so we're on to listener questions, and we've got a really interesting one, haven't we?
So we've got somebody asking about liquid nose jobs.
Ooh, liquid rhinoplasty. So this is where we can use filler, so dermal filler, injected into the nose to change the appearance of the nose. And can change quite a few bits and bobs, tip, bridge, even the side, you know, have the side appearance of the nose. And it's quite a popular treatment. It's quite sought after. Have you heard about this one before, Em?
Yeah, I find it quite interesting because I think your kind of logical brain would tell you that if you're injecting filler into the nose, you're going to make it look bigger. But actually, if done well, you can somehow make the nose appear potentially smaller. I feel like sometimes. I think it's very clever.
It is. And then there's, you know, a massive caveat and disclaimer to put here. So liquid rhinoplasty using dermal filler in the nose is a very, very risky procedure. Okay, so absolutely you must not go to just anyone for this. If you're going to go for liquid rhinoplasty or nose filler, you must go to a qualified doctor, and more importantly, a doctor that potentially, specializes in just liquid rhino, because they need to have done it a lot. They need to know how to handle it. And there is a complication and a risk of going blind with this treatment, and that needs to be put out there because people don't realize. So yes, you're right, it can make the nose look smaller, it can change the angles, it can lift the tip, all sorts of things. But I always say to my patients, it's a case by case, and this is really important, because what you can also do is you can widen the bridge if you're doing it repetitively. And what we're seeing is people going in, it's looking great the first time they've had it, and then they're wanting more and more, or the filler's breaking down, it's not looking as sharp or as thin or as small anymore, and they want to now go in and have more, and it's widening the bridge, and then they're looking different, and that avatar look comes, and then they don't like it, and they're getting it all dissolved, and they're going for a nose job anyway. So actually what I say to patients, when they come in, I look at them and I think, is this going to work? It doesn't work for everything. And if it's not, and they're serious about wanting to change their nose, and we've gone through all the screening, and we understand that it's an insecurity, or that they definitely want to get it sorted or changed, and we've done all the checks and done everything, then I will refer them on to a rhinoplasty surgeon to get a consultation, because you don't want to just keep putting filler in if it's not going to be long term, or it's not going to give you the desired result, or worse still, and I worry about this, you're going to somebody who's not as experienced, and they're just injecting willy-nilly into your nose, and you can get here when they're injecting into the tip, that can cause tissue death as well if you're not careful. So
and I've seen that online, you see, don't you, people post online when they're getting tissue death in the tip of the nose.
So if the question is, what do I think about liquid rhinoplasty and would I recommend it? It's a really difficult one for me. I wouldn't use the word recommend. What I'd say is, if you're thinking about liquid rhinoplasty, go and research a doctor, or a doctor or a health professional that has got years of experience in this, that does this every single day, and that can give you an honest opinion on whether this would work for you. And if it wouldn't work for you and you want a second opinion, go and see a rhinoplasty surgeon. And if you're doing it because you're not, I was mentioning about when I was younger and I looked at pictures and thought that I had to change how I looked, just take some time out, take a cooling off period, and just step away. It might be that in years to come you absolutely love that nose of yours, so don't worry about it.
Well, thank you so much for listening, everyone. I actually feel so excited. We are done on the episode. Send in any listener questions. We want listener questions.
Please send any listener questions in. Please send any comments that you have, any topics you want us to add in. We want to sort of go on this journey with you, don't we? We want to make sure that we have covered things that you're interested in listening to as well. So,
and nothing's off limits. Nothing's embarrassing. Nothing's weird or gross.
I think as doctors, we've seen it all, haven't we? So,
we have.
Forget 100%. As doctors, as mums.
Yeah, doctors and mums.
You have seen it all. Yeah, let's do it. And don't forget to like and subscribe.
Oh, I always wanted to say that.
I'm so excited.